we want to talk about common mistakes, common fertility mistakes, right? Thank you for the follow. Common fertility mistakes, the most common fertility mistakes. Are we ready? Right? Are we ready for this gist? And you know the thing, these mistakes actually really feels like mistake. How would you? People who make mistake, do they even know that they are making mistake? Right? It really feels like mistake. In fact, it often feels like you are being patient. Yeah, it's like you are trusting in nature or you're trusting God. God will do it one day. I believe in God, right? Couples will say things like, let's give it more time. It will happen when the time is right. Question is, when is the time going to be right? When? Thank you, lovely. Thank you. Right? Some would say, we don't want to rush into hospitals. Oh, really? Is that so? These sentences I just mentioned now, they sound wise, actually. They do sound wise. They sound like you are just trying to be calm. They sound like you are emotionally healthy. Let me tell you something. In fertility medicine, yeah, one quiet pattern appears again and again across clinics. And what is that pattern? Besides clinics, it also appears in cultures. It also appears in countries, depending on where you are, right? And the pattern is the common fertility mistake is waiting without understanding what is actually inside the body. You're just waiting. You don't know what's going on. Let us wait. Maybe next year. It's just 1 year. Maybe next year it will happen. We have taken a go. Don't worry. You don't know what's going on, right? Waiting is not a plan. Waiting for pregnancy to come is not the plan, right? When you wait without medical guidance, it's a mistake. Why? Because there's so much uncertainty. You're hoping time will solve all the problems that has not even been identified. That is a big mistake. Time does not solve fertility problems. You're right? Time does not solve the fertility problem. Even for those who say, oh, we want to wait on God. We want to have faith. Excuse me, I thought there is something called faith without works. Right? So what is the works? And there cannot be works without knowledge. Just be smart with your life. You are crying for nothing. It's not the time to cry. Oh, I'm about to lose my home. I've been trying for 10 years. Calm down. You're just wasting tears. And tears is good because tears will wash your eyes. Yeah. And now this is the reason why mistakes happen everywhere. The reason is from childhood, people people hear things like, oh, be careful. Pregnancy can happen anytime. Almost all the ladies here have heard that before. Say, as you are going, if man just touch you like this, you carry belly. This is the kind of thing that implanted in our mind that when we wait, pregnancy will come on its own time. Pregnancy does not come on its own time. Yeah. Or you've heard things like it's only one time that you need for pregnancy to come. Like the story of the young man I said the other day, right? A, young people, teenagers, for some reason the girl got pregnant, and they were interrogating. Say, "Wow, how do you people come about this and blah 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 blah?" The boy said, "Only one time, oh, only one time." He go to wonder how many times did he right? It's only one time. It's only one time. Well, I hope you know that as you keep waiting for that one time, the time is also going. Yeah, the time is also going. Some others have heard things like fertility is natural, it's not automatic. All these things are not false, but they are they are they are things that our culture has inculcated in us. So when couples finally get ready for pregnancy, what are they expecting? They're expecting that they're getting quick results. They're expecting a predictable outcome. The moment we just knock like this, bam, we get results. Yeah? They will expect that natural process. You don't need any assistance. So when pregnancy does not happen quickly, confusion begins. What happened? They're now confused because the reality of fertility is different from the story that people were told when they were young. The reality of fertility does not follow those stories. These are just cultural norms to keep you chaste. Well, did it work? Look at what these children are doing all over the place. Did it work? I don't think it did. So if you are still here, tap on your screen, share the live, just 1 minute, and I'll be right back. So, having said all that, let's continue with our gist. Do you know that even in perfectly healthy couples, the chances of pregnancy per cycle is about 20 to 25%. Nothing is wrong with you. Your menstruation is regular. You're ovulating just okay. Right? You're ovulating just okay. You're good to go. But the chances of becoming pregnant is just 20 to 25%. Yeah. In healthy individuals, I mean, not those who even have challenges. In perfectly healthy couples, it may take several months to conceive naturally. Now, for those who are perfectly healthy. So just keep thinking in your mind. For those who have been cleared medically healthy, the chances of even conceiving per cycle is 20 to 25%. Then it may even take some months. That's why some people will come and say, "Oh, doctor, we've been married for 5 months now. Nothing has happened. Calm down." It may take several months to conceive naturally. Right? Why? Because conception depends on multiple biological events that must align perfectly. It does not respond to your emotions and how you want it. No. The conception depends on multiple biological events, and these events must align, right? And that is to say, pregnancy requires a healthy egg, a functional sperm, yeah, a correct timing. So many people are just enjoying themselves outside the time they can conceive. So, correct timing. Pregnancy will also require open fallopian tubes. Fallopian tube has to be open. Some people have presented with blocked fallopian tubes, one or both of them, right? And they want to ask, what should I do? The brutal truth remains, depending on your history, we'll advise you on what to do so that you don't waste your time, right? Pregnancy also depends on a receptive uterus. It's not enough for fertilization to take place, but can your uterus receive this conceptus, this embryo? Can it? And lastly, pregnancy will require a viable embryo. There's also something like embryo quality. Poor embryo quality will amount to miscarriage. Right? Will amount to miscarriage. So, all these things I just said, if you miss just one of these, it can stop the entire process. And now we still go over and over again, year after year, waiting, and yet don't understand what the problem really is. But that's why we are here for you, to put all the information on the table, understand the problem, then we can now direct you on what the solution should be. Yeah, we'll get to you, Lara Sport, in a short while. We have time to ask your questions and stuff, right? The problem is this: many couples are waiting without knowing which link in this chain is the weakest link. All this is I just mentioned. We don't know. We are trying. We're trying. Abigail, I see you. Don't worry. All of you ask your questions. Is that okay? Yeah. The network is slow, but just keep tapping on your screen. Keep tapping on your screen. Don't be discouraged. And make sure you're learning something. Is that okay? Make sure you're learning. All right. So, I want what? I want normal. You want to know your ovulation. You will. Don't worry. You will. When you ask many couples how they are trying, you may hear things like, we stopped protection. We have regular sex. Mrs. Arrow, I see you, right? I see you. They say we have regular sex. We are just letting nature take its course. Oh, really? Clap for yourself. You're letting nature take its course. It feels like progress. It feels like responsibility. It feels like effort. Good for you. Good evening, sunshine baby. I see you. But medically, these things you think that feels like effort or progress or responsibility, this may still mean that you're having sex outside your fertile window. You've got to know your fertile window. You're having sex irregular or absent. Some people have irregular ovulation and some have absent ovulation. And I mentioned some things about that the other day. Will help you out. Is that okay? That reminds me of a friend, dear friend of mine. He said, "Oh, doctor, I want to conceive, but it's not coming." Then after troubling me with all the information of this test I went to do, another, then she ended the gist by saying, "But I don't like sex." Excuse me? You are not serious with your life. You are not serious with your life. Is it immaculate conception you are considering? Because I don't know. I don't know. I know biology, right? Look at all the time I wasted trying to find solution for somebody who will just not have sex. You don't have to pay for it now. No matter don't tire me since. No more won't talk. So some people are uh, having sex outside their fertile windows. Some are having irregular ovulation or absent ovulation. Some have blocked tubes, tuber blockage. Some people have poor sperm quality. Some others have uterine abnormalities. So, regardless where you belong, trying without understanding is like throwing your seed into soil without checking if the ground is fertile. The season is right. The the seed is good, is viable, but the ground you didn't check whether it's a good ground because you need to go and find out what's wrong, right? Effort alone will not guarantee your growth, right? Effort will not guarantee your growth. So be smart, be smart, right? Many couples wait. Those who are trying to conceive, many of them will wait for 2 to 5 years before seeking evaluation. Clap for yourself. Clap for yourself. You are doing. You try. And that is a global problem anyway. Say we have been trying. It is after 2 years has passed or 5 years has passed, then they present themselves to the hospital. You try, right? Some others, the 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 male factor, right, is often the last thing they check. The woman will be evaluated year in, year out, going for tests here and there, and the man is outside the picture. Then finally, you go and test. Maybe that was even the problem. Years have come and gone, right? But we'll teach you how to do it the right way so that you don't misstep, right? And another problem is fertility awareness is low, even among educated populations. Many people who are educated are not even aware of reproductive health or fertility. So anyway, that's why we are here, to teach you, to expose you to these things, so that you don't walk in the dark. You've got to walk with precision and understanding, right? And there's also the problem of cultural stigma that usually will delay medical consultation. Don't let anything stop you this year. Join the TTC League now. If you are trying to conceive, April 1st, you've got to be in the teams, right? You don't wait. Because the earlier you join, the better for us to be able to zero in on your matter and give you all the support you need. Don't wait. You are not paying, but we are here to help you. So join now. When they keep on waiting and waiting and waiting, by the time many couples walk into the fertility clinic, the woman is older. Years have come and gone. They are presenting when the woman is now older. And what did we say? Fertility is age dependent. Age dependent. You were waiting, 30 years has passed. You were waiting, 35 years has passed. You were waiting, 40 years has passed. And every time you cross these milestones, the percentage chance to conceive drops. That's why I keep on telling people, the time for you to conceive is today. Today is the time, not tomorrow. The time for you to go for that IVF is today, not tomorrow. Because the 1 minute you are spending here on this live stream, you will never get it back. Right? So by the time couples will walk into the fertility clinic, Either the woman is older or the condition that they present with has progressed. Yeah, that's progressed. And now the fertility options that they have are now fewer. Fewer. And trust my people, they will still, even if you are option, they will still argue with you. Hello, good evening, happy beauty world. Good to see you. You're welcome. I know the tragedy of the matter. The real problem is not always infertility. The real problem is the lost time that could have preserved or present to you the simpler options. But we keep on waiting and waiting. God will do it. We went to see her, we went to prayer house, you're wasting time there. You're wasting time. Right? But come to think about it. Those of us who are even in the business of it, we're also praying for you. So what double blessing you have. Oh boy. Join the TTC League, I'm telling you. Alright? You don't want to deceive yourself. Please don't deceive yourself. Right? You don't want to deceive yourself. Do you know about the invisible clock? The use of substance generally affects it. Yes, ma'am. Happy. Are you following me yet? You want to follow me? Have you heard about the invisible clock? The invisible clock is the age factor. Age factor. For women, egg number declines steadily from birth. From birth, egg factor declines. And I will say it 1,000,000 times over, and I will still say it. When a baby girl is born, all the eggs she will ever have in this world, she was born with it. So women don't produce eggs like men produce sperm. Is that okay? All the eggs she will ever have and ovulate in this world, she was born with it. So as she continues to grow, there is a geometric cut down of that number. That is why, as you grow older, the quantity diminishes and quality also diminishes. Egg quality declines faster after 30 years. After 30 years, egg quality declines faster. It's like it's in a race to stop conceiving. Right? And that would mean fertility decline also, right? What about 35 years? Fertility drops significantly after 35 years. Two obvious reasons. Egg quantity declined, egg quality declined. Even when fertilization takes place or pregnancy happens, the risk of miscarriage is high for those who are 35 and above. You see, when you keep waiting, you are putting yourself in a place of many challenges, hydra-headed problems. Right? So fertility drops significantly from 35 years and above. Right? And miscarriage rate increase from that age. Why? Because of quality. Poor quality sperm, poor quality egg will produce poor quality embryo. Poor quality embryo will be terminated by the body. I hope you know that the body has a quality assurance system, quality control system that looks at this pregnancy that you are carrying. Does it align with what is supposed to become a human being? If the answer is no, because of poor quality sperm, it terminates it. It terminates it. And that is what miscarriage is. I say, oh my God, I've had miscarriage, and you're crying and crying and crying. I tell people it's not every miscarriage that you cry about, because the body that terminates is not stupid. Right? That is biology. Is that okay? So that is for women. What about for men? The invisible clock. Men too have clock. Men too have clock. So they say, oh, no, nothing is wrong, nothing is wrong. I will impregnate anybody anytime. Oga. Why that is almost true. You need to understand that sperm quality declines gradually as you grow older, especially from 40 and above. DNA fragmentation increases as you grow older, right? The time for conception becomes longer. You that when you were in your 20s, just small knack, when you knack like this, the woman don't get belly sharp. But now as you're growing older, it's going to take longer knacking, many knacking, for pregnancy to happen. Right. Right. The risk also of genetic abnormality rises with age. That is the reason why the risk of miscarriage also increases, because of all these things. So you don't want to waste your time, right? You don't want to waste your time. A woman in her early 20s has 25 to 30% chance to conceive per cycle. Early 20s, listen, not 100% chance. You want to think that is the best time to conceive? Yes, even that best time, and her health stops very healthy. It still remains at 25 to 30% chance per cycle. Right? And of course, I took time in the first season to explain what happens to sperm in the uterine tract, in the woman's body. If you missed that, I hope we'll get there one day, but we got to move on, Right? By late 30s, the chances for a woman to conceive drops to 10 to 12%. Right? Chosen depends on your age and depends on your history, right? Depends on your age and depends on your history. So if you want to come up and ask, let's talk about it, and let's know one or two information that can help. Yeah. Then by the time a woman gets to 40 years, the chances of conception drops even further. In fact, it's not drops, it falls to like 5% chance. So the knacking no be here, but the pregnancy will slow to come. Do you understand what I'm saying? The reason why I say age factor is the invisible clock. The reason why I said so is because age does not announce itself. Every live stream we do, I grow older. Few years to come, you will see white hair all over the place, and I'll still be doing the same thing, right? You cannot tell the age. The age is just there, clocking every hour on the hour, right? It's just going. Age does not announce itself. There is no alarm, no symptoms for age, no warning sign. The clock just moves quietly every day, every hour on the hour. That's why I tell you, when is the right time to conceive? Today. When is the right time to go for IVF? Today. Don't wait. When is the right time to see your doctor to get evaluated? Today. You don't know what's wrong with you. You got to be evaluated. Today is the right time. So if you're just joining, make sure you're following me. Make sure you join my fan club, right? Drop a heart me. And make sure you don't miss, if you're trying to conceive, don't miss the April 1st TTC League. Do not let network discourage you. We'll keep doing what we are doing on the third, right? Do you know that waiting, you just keep waiting? Let us wait. Waiting can change all your options when it comes to your treatment options, when it comes to fertility. And now this is where the most common mistake becomes more visible. This is where it becomes more visible. In the early fertility journey, the options you have may include lifestyle adjustments, yeah, ovulation induction, timed intercourse, minor hormonal corrections, or even small procedures like maybe fibrotubation and all that, or even scraping of the endometrial wall, right? And now these are less invasive, they are less expensive, and they are less emotional draining. After years of waiting, because you were waiting blindly, your options now becomes IVF. And many people hate that. They don't want to hear, oh, doctor, is that the only way? Is that the only way? Well, you have waited it out. So your options, it narrows down to IVF or repeated cycles, or you have to go for donor egg or donor sperm, or surgical interventions, or now your success rate is so low. What changed? What changes? It's not just the diagnosis that changed, it's this time that changed the options. So when are you supposed to conceive? Today. Today. Or when should you start trying? Start trying today. There's also the financial implication or impact of, of waiting. Why? Because in your early intervention, you often require minimum treatment. Of course, minimum treatment means lesser money, right? Right? Which means you have higher natural conception chances. The cost is less overall. But when you delay intervention, what happens to you? You now require advanced procedures. You now involve multiple cycles, and there is this increased emotional and financial strain that it puts on you. That's what it does, right? So time converts preventable problem into expensive solution. That is why you should not wait, right? That's why you should not wait. Don't wait. Don't wait at all. For many couples, the journey follows a predictable emotional arc. Like In the first year, they are excited, they are optimistic, they casually just try. It's the first year now, nothing they happen. It will happen when it's supposed to happen. In the second year, they become concerned. This thing, why would they do like this? They become concerned. There's this silent anxiety that begins to creep in. And of course, subtle pressure from family. That's when you hear things like, what happen now? How do they used to say it? They say, sister, you never chop beans. Right? I heard that. I heard that one time. Very funny. Right? So these are subtle pressures. These are subtle pressures. By year 3, emotional strain, blame. It is your fault. It is not my fault. It is past abortion. It is all manner of blame and guilt sets in. Relationship tension, of course. Fighting, quarreling. There's a lot of tension in the relationship. Why? Because pregnancy has not come. Pregnancy has not come. Then, if the waiting has gotten to 4 years and above, what do you see? Urgent medical intervention. Regret about lost time. If we had known, for some people now, they say, if I had seen you long time ago, well, I'm here now, right? I'm here now. So others will regret lost time and the fear of limited options. But there's nothing you can do. You're already here now, so let us do what we need to do to salvage the situation, right? Most regrets are not about needing the treatment. They are about waiting too long to understand the problem. And that is why we are having this live stream. Most people talk about fertility as per they want to treat you. But I talk about fertility because I want you to understand the problem. Because if you understand the problem, you will now know how to find the solution. And of course, the costs of finding solution becomes minimal. Is that okay? Oh boy. Right? So, this is what trying right looks like. Trying right means that you understand your fertility window. How many of us here who are trying to conceive? I'm talking about those who are trying to conceive. How many of us here who are trying to conceive, you understand your fertility window? Just do like this in the comment section. No louder. Just do like this. All right? You understand your fertility window? Just do it. Right? So that's what trying right means. You understand your fertility window. You are confirming your ovulation. You have tested the sperm, that is semen analysis early, and you understand age-related timelines. You know where you are in this age timeline. And of course, you are seeking evaluation at the right time. You're not just sitting down. You're seeking evaluation at the right time and making decisions based on information and not fear. And that's why we are doing this. So the decision you want to make, it should be out of information and not out of fear. Trying will not replace. Now, when you try right, it will help you to walk in informed paths. You will not have blind hopes. You will not walk in ignorance. All that will cost you money anyway. So this is the truth. The truth is that the most common fertility mistake is not actually a medical problem. The most common fertility mistake is all about information. And that is the information we are bringing to you. Right? People are not losing time because of disease alone. Nah. They are losing time because they do not know when to act. That's why when you join the TTC League, we can now have an eagle eye on all those that are trying to conceive, whether natural or ART. Now we're feeding you with information and also watching your timeline for you and giving you the right advice, guidance that will help you save time and get your results. Right? This is what every couple that are trying to conceive should ask themselves. Every couple should ask themselves these questions. Are we trying with knowledge or we are waiting with assumptions? Remember, fertility is not assumption. As much as you have hope, hope is important, but hope works best when it is guided by information. Yeah? So I want to leave you, before I begin to take questions tonight, I want to leave you with one thing. Infertility is not the most common mistakes. No. The most common mistake is ignoring the need for clarity, information. You just want to walk in ignorance and you continue that way. But we're here to help. Is that okay?